Hey, so I am Julie Lanford with Cancer Services, the Wellness Director, and I'm very excited to be here with Dr. Stacy Wentworth. And hey, Stacy.
Hello, good morning.
So Stacy is a board certified radiation oncologist. She is assistant professor of radiation oncology with Wake Forest Baptist Health Comprehensive Cancer Center. She's also the medical director of survivorship over at Wake Forest Baptist Health. And as myself and I think her husband have termed her, she is part of the everyone should listen to her club. So that's why
Well,
we've invited her today.
we'll see if the dogs listen to me during this recording of this podcast.
So thank you so much for being here. We know that all the healthcare providers are kind of scrambling to figure out how to provide care, what care to provide. But today I really wanted to ask a couple of questions that I think a lot of our clients are wanting to know more about. You know, and I would start with, first of all, I think it's important to hear from your opinion. What are the most important things that patients and survivors need to know right now?
Well, thank you, Julie, for having me on. I have been thinking a lot about our survivors in this time. I think it's really been hard for survivors and for providers to be separate from each other. Uh, Most importantly, I just want to emphasize that we are doing this together. We are flattening the curve. We have seen less hospitalizations than we were expecting. We've seen less infections than we were expecting. And that has been because of the American people, the people of the world coming together. And people are coming together to protect themselves, but they're also doing it to protect our patients who could be immunocompromised. They're doing it to protect their family members who may be at higher risk. And I think that's really wonderful. The other important piece of this is that as this has been rolling out, I think that we need to form some strategy in moving forward, because I think we're going to be in this time of uncertainty for probably months, if not years. And so this is turned into a marathon and not a sprint. And it's been kind of interesting in hearing from some of my survivors in that the skill sets that they developed in dealing with cancer and fear of recurrence and living in uncertainty, they kind of are bathed in the waters of uncertainty, and they have really opened my eyes to some of the skill sets that they formed. And I think that drawing on those skill sets and then maybe being able to like pull out those tools and show them to other people who are now in uncertainty and need those tools now that our patients and our survivors have started to develop. And maybe they're a little bit rusty. Like maybe you haven't thought about, how you got through your initial diagnosis and how you converted over to surveillance in a while. But gosh, those skill sets are still there. And I think it's important to know that those skills are within these people. Everything from information overload. So in our newly diagnosed patients, they have this information overload. So-and-so's brother's, neighbor's, wives, high school boyfriend had this happen, and he tried this, and he ate garlic, and his cancer treatment was wonderful. And going through all of that, like, how do you find that one piece of information when there's so much information flowing over you, both through social media, through Facebook, but also through relatives? Hey, did you hear this? Hey, did you hear that? And how easy it is to get drawn into different pathways and think, oh, if I do this, or oh, if I do this. So it's all about managing uncertainty and finding that grounding piece. And I think our patients have been through that, and we're able to do that, and we're able to find that centering. And I think that's what the world really needs right now. And so I think our survivors can take a look in the mirror and be like, man, this kind of maybe feels a little bit familiar. And in a good way, they may realize that they've done some of this before. And I think it's important for us to listen to them even more now, because I think they have a lot to teach us.
Yeah. So I think sometimes people aren't quite aware of how maybe they coped with their
Yeah.
diagnosis, or they need to be reminded that, oh yeah, that was kind of tough. Because especially if people are out of treatment, you're just like, oh, good, thank goodness, and you have this amnesia of like, oh yeah, I kind of forgot what
Yes.
that was, if especially I think if it's been more than a year. you kind of just forget. But it might be helpful if you journaled at that time to go back and see what it was like, or even just talking through with a loved one.
Yes.
Hey, do you remember what it was like when I went through, and like, can you remind me what what was helpful to me back then? Because like you were saying, it's something that they could share with others who are really struggling to not take in too much information, or to just figure out how to calm down when they're maybe overly anxious.
I think that's so true. And those skill sets maybe are something they haven't drawn on for a while. But if you think about that initial diagnosis phase and when all the information's coming and it just feels like a whirlwind and you're not sure where you're at and what's going on and everybody's telling you different things and you don't have a plan, and then you get a schedule and this is your treatment and this is your date for your first chemo, your first radiation, your first operation, your first shot. These are the doctors you see. These are the areas that we recommend that you go to for information. Finding that, thank you so much for helping me and thank you for that information. I'm going to listen to my doctors right now, and getting that script going. I'm going to listen to the CDC right now. I'm only going to listen to this 1 hour of information. This is where I'm going to get my information, and sort of consolidating that. Because if we all try to follow everybody who's trying to give us information, it's really hard to do. If it's the cancer services email, this is where I'm going to get good information. It's where I got good information. If it's going to where you got your cancer treatment, going to that center's website. If it's going to the American Cancer Society website, if it's going to the CDC website, choose that 1 or 2 places where you're going to get your information, and then create a schedule in your day. A lot of us are working from home right now, or we've had changes to our schedule. We usually went grocery shopping on Thursdays, but now it's nerve-wracking to go to the grocery store. We usually went and had lunch with our friends on Saturday afternoon, or we went to yoga on Sunday evening. And creating that schedule, even though it may be a virtual schedule, it's finding that, okay, I'm going to go on Instagram and I'm going to dance with the Rockettes Tuesdays at noon, or I'm going to go and do a wellness program at Cancer Services, just like I did, just like a support group. I'm going to attend that virtually, and start pinning those things and creating that structure. Again, I'm going to have chemotherapy every 3 weeks. I'm going to have my surgery on this date. This structure and this schedule started to take this huge thing that's difficult to wrap your mind around, and start to put in place some markers that you lay down for yourself to say, okay, I did that. I think it's also really important that, again, I think similarly to cancer, this virus is something that seems such a big problem, and you can just get lost in how large it is. Truly, as human beings, all we can control is the 3 feet around us. We control what information comes into that 3 feet. We control the people that come into that 3 feet. We control what our arms and our hearts and our mouths can control in that 3 feet around us. So that is something that patients, like, if it's not, I usually volunteer at a food bank, or I usually go and read to children. It's finding another way to meet that service need that's within now your 3 feet, because that's all we can really control. And if you get too involved in how am I going to change the world, or how am I going to help people in New York, physically going to New York is not possible for most of us right now. But can I go online and write something supportive for somebody who is going up there? Can I reach out to a neighbor who I know is really struggling with this and just leave a note in their mailbox? Like, what is it that is that small thing that we can control? So I think finding good sources of information and limiting those sources of information, creating a schedule and laying down markers for ourselves, and then finding something in our 3 feet that allows us to feel like we're helping or doing something. I think those 3 things start grounding us when it's easy to get washed away out into the big wide ocean if we don't ground ourselves on solid ground.
Yeah, I definitely found, having transitioned to work from home, that the first day I was home, I was like, there was no schedule. And
Yes.
I just felt like everything was everywhere. Everything was urgent. I didn't know what I was trying to work on.
Yeah.
And so I quickly had to figure out what is my work schedule, and
Mhm.
also like when do I stop
Yes.
doing whatever it is that I was doing so I could be sure to go focus on something else. And that has helped a lot. And I have created kind of a routine for my day that is very different from the routine that I used to have, but you know, it didn't take long for me to kind of settle into it. And I think a lot of people who've gone through cancer treatment or who are in cancer treatment now, you know, a diagnosis and treatment schedule completely throw off your regular schedule already.
Yes.
Um,
Yeah.
so I don't know if it's helpful to feel like, oh, well, at least everyone's having to throw off their schedule right now. But also being intentional, like you said, about figure out what your schedule is and have that calendar so you know when you're doing what. It gives you something to look forward to,
Mhm.
and to try not to get sucked into like endless news cycles and worrying, and there's a
Right.
lot of unknown that we just kind of have to be patient through right now. So find things you can do that you enjoy while we all kind of wait.
And I think that's exactly right. I think putting stops on your schedule to say I need to have social time, like I need to have water cooler time, because we're all at home working, just as the same thing as you are going through cancer treatment while working. So the priority becomes, or the thing that's happening is I am at home working, like trying to work. We are, in the midst of a pandemic that is unprecedented in our lifetimes. We are learning to work in that. So I also have encouraged, especially some of my overachieving patients, to strive for mediocre. So everyone is trying to do the best they can at so many different things. And if you got to your cancer treatment and interacted with your physicians and got home, that's enough.
Hmm.
If you did one thing, like it would be great. I am not going to train to run a marathon in my house. I am, maybe going to microwave more meals for my family than I used to. My husband is cooking breakfast for dinner more than we used to. My friends' children are watching more videos than they normally do. All of those things are normal and good as we try to adjust to this new normal. So I think holding ourselves to a highest standard in the midst of a great social change is really difficult. And I try to, and our patients have been so gracious as we're trying to, like, we don't get to hug them anymore. We're
Mm.
seeing them behind masks. Their family members aren't coming in with us. So figure out sort of how you can lower your expectations for yourselves and your family members, and just have grace for everyone, including ourselves. And I think that has been communicating with patients over the phone, making sure that I ask them or that they ask me, reminding them to ask me, hey, I need to phone in somebody. Is it okay if I put somebody on speakerphone? Because they really need to hear this, because they're the ones out in the car waiting to take me home. So not being afraid to say this is what I need, and also sort of lowering expectations of what happens in this time. I think, again, sort of aiming for mediocre from ourselves, excellent patient care, excellent hygiene. But as far as all the extracurricular things that we do, trying to just say, okay, I'm just going to do this one thing today instead of these 10 things today. This has been really helpful.
Yeah. Okay. So you touched on some practical things.
Yes.
So I wanted to ask, for someone who's either newly diagnosed or currently in the middle of their treatment plan, they have to go into the treatment center, get their
Right.
treatments. They're not the people who are like, oh, I can put it off. They have to go in.
Right.
So practically speaking, like, it sounds pretty wise. Bring a phone with you so that if you have a loved one who's waiting in the car or whatever, they can join at
Mhm.
an appointment, a weekly appointment or whatever, just by phone.
Yep.
But what are some other, like, just practical things that they need to do when they kind of prepare to do when they physically come into their doctor's appointment?
Sure. The first thing I would make sure that everyone is, if it's at all possible, is to have you or a family member download the app for your center's EMR. So much communication now is happening through the electronic medical record. And you can ask, as if you check in for your appointment or you check in with your nurses, you can ask them, how do I do that? Or can you help me with that? And that may not be you. You may not have a
Mhm.
smartphone, that you may not have a cell phone, but somebody in your immediate circle does. And that will help you communicate with your providers, help you keep up with your labs and your appointments. So I always ask patients to download that app first, or have a family member who has access to that. The second thing is wear a mask when you go into treatment, wear a mask when you're out in public, wear a mask when you come into the hospital. The third thing is make sure that you are thinking about the screening questions that people are asking you as you're coming into the cancer center. People are going to ask you about shortness of breath, cough, fever. When things become routine, we don't start thinking about them and we just say no, 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 especially when we really want to get to that cancer treatment. Obviously, the virus is something we're screening for, but there are other things that can be happening. So making sure that you're not just answering those things, no, 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 I want to get to my schedule. I've got 5 minutes. I got to get in there. So think about those things. Talk to your provider. If you are feeling short of breath, if you're having a fever, if you're feeling under the weather, we have plenty of testing. We want to test patients for this virus, not only for you, but so that even if you don't have symptoms, you aren't spreading it to other people. The second thing is when you are in there, if you see your healthcare providers, make sure they're washing their hands. Make sure you're washing your hands. Ask them, hey, could I have one of those wipes, or could I have something to wipe down my cell phone or to wipe down this area? Make sure that where you are going to get your treatment, you feel comfortable that that has been disinfected. What are you guys doing each time I get on this radiation table? How are you disinfecting this? How are you cleaning the rooms? I think sometimes the unknown is really scary. All of us have done so much in the way of disinfecting things and preparing things for our patients. To know that that's happening, which you may not see with your eyes, but to be able to go back to your family and say, okay, these are the 3 things that they're doing to keep me safe. The other thing is when you're in a waiting room, so many of our patients develop relationships with other patients that are getting treated at their same time. You will notice that a lot of waiting rooms now have 6 feet apart. Make sure that you are doing that. Don't move furniture. When you come in, take a pause. When someone else is checking in for their appointment, try to keep 6 feet away from them and say, okay, even if there's not a mark on the floor, just be aware that that is happening. There's not enough healthcare providers and staff to do that, but the same things that are happening, just because you're walking into a cancer center doesn't mean it's more or less dangerous. So the things that you're seeing and doing in other places, make sure you're observing those social things as well when you're coming into the cancer center. And then when you leave the cancer center, make sure as you're leaving, you're washing your hands, you're using some of the 60% alcohol-based hand sanitizing solution, and going back into the car, again, wearing your mask, and that your family member is wearing a mask when they come and pick you up. When you get home, wipe down your phone, either with a Clorox wipe or with just a very slightly damp rag, just wiping that off with soap and water, just to make sure that your phone has been wiped off, because that's the one thing that you took into the cancer center that a lot of us don't realize how much we touch,
Mm.
and when we touch our faces and we touch ourselves. So cleaning that phone. Those are the things I think that are practical things when you're coming in for treatment. When you are getting treatment, such as chemotherapy, radiation, not usually, surgery, not usually, but mostly chemotherapy can affect your immune system. So you are part of a higher risk group because the chemotherapy can lower your immune system. So taking extra precautions in not being around sick people and maintaining that 6-foot distance, and asking people to just support you virtually. So again, setting up a weekly appointment for you and your friends to get together, but asking them not to come over to the house. If you're especially your children or your grandchildren want to come over, they need to sit in the yard, they need to sit in the driveway. As hard as it is to not see those people, those are the people that can bring that virus into you and your lowered immune system. We know from the Chinese data that that patients undergoing cancer treatment had a higher risk of death than the normal population. So really understanding those are mostly patients getting chemotherapy along with other treatments. And again, you can't control everything. So just decreasing the risk as much as you possibly can is important. And that mostly is for patients that are currently undergoing treatment or are on treatment that is that is immune therapy or is therapy that is modulating their immune system. Mostly not for long-term survivors who have recovered and have a normal immune system. Their lab tests have been normal when they've seen their doctor. You can go online, again with the app, check your immune system, check your white blood cell count. You can definitely ask your doctor, hey, am I at higher risk? A lot of this we don't know. I also tell patients, even if you're 2 or 3 years out from treatment, if you're a survivor, decreasing your risk of other things. So continuing to work out, continuing to exercise regularly, watching the fat in your diet. Once we've all gotten through that initial, oh my gosh, it's stressful, I'm gonna eat fried chicken and ice cream. Once that's happened, getting back to your normal so that you're not hospitalized for other things like heart attack, stroke, COPD, these other things, heart failure, these things that can really cause you to have to go to the hospital. Controlling those things eliminates your need to go to the hospital where you may be exposed or take up healthcare resources from somebody who may need them.
Great. So with the masks, are you finding your patients, I'm sure you guys are giving them masks if they don't have one and they come in,
Yes.
but are a lot of patients just coming with their own
Yes.
homemade masks?
Yes, very much so. Yes.
And so what's the recommendation for washing those?
So we tell patients to try to use a different one every day. And if they're a homemade mask, then to use it for the day and then wash it. Or if it's become visibly soiled, if they sneeze into it, if there's for whatever reason blood or snot or anything on it, just get a new one.
Okay.
But that's another thing. People are trying to figure out how to help other people. If somebody wants to know what to do for you during your cancer journey, having 7 or 8 or 9 masks so that there's something that you can wear every day. I think doing that in and around your home with your spouse or with your children who are living with you, I don't think you're all up in each other's business anyway. But when you go out into the world, preventing you from spreading it, if you have it, is the reason we're all wearing these homemade masks, and then staying 6 feet away from people, eliminating unnecessary trips, and then trying to just be aware of where people are in the world, maintaining that 6 feet distance between people. I
think, you know how there's day of the week underwear, we're going to need day of the week masks. So that
not made out of the day of the week underwear. Do not make masks out of underwear.
Don't make masks out of underwear. I did, when I didn't have a mask, I did make one for myself and my 9-year-old out of socks. And she wasn't very happy about that. But guess what?
No.
Guess who doesn't mind her nice handmade mask now? When it's compared to wearing a sock over her face.
Again, mediocre. Set your level. It's a sock mask. It's going to do for now. Absolutely. There are so many creative ways. Who knew that this is where we would be and how to make creative homemade masks?
And if you need masks, we have, we got donations from Project Mask Winston-Salem. So we did get some yesterday. So they're in the office. If people need them, they can just give us a call.
That'd be great. What's really the number for that, Julie? How do they get in?
So yes, we're at 760-9983.
Great. Perfect.
And we do have advocates from 9 to 4 Monday through Thursday and 9 to 2 on Fridays. And we aren't encouraging people to come in, but if you call ahead and you tell us what you need, like plenty of people are picking up supplies and filling out paperwork and dropping it off. We have a great system of how you can drop off and where we can put stuff for you to pick up, and we can talk to you through the door if there's a question while you're there, or you call us when you're in the parking lot. So we have a pretty good system, and we have advocates there, ready to help with that.
Great.
So you talked about survivors who've completed treatment, a little while ago, like 2 or so years, about their risk, but can you remind us what the risk profile is for people who are completely done with treatment, recovered, but they are cancer survivors?
We think that their risk is the same as a normal population, as long as they haven't gone through an allogeneic bone marrow transplant, so that's somebody else's bone marrow, as long as they're not on immunosuppressive medications due to their transplant, or they're not on chronic immunotherapy, such as lung cancer patients or breast cancer patients may be on immunotherapy. This does not include things like Arimidex, tamoxifen, these other medications that are used to decrease the risk of breast cancer. It does not include hormonal therapy for prostate cancer patients. It's really these immunomodulating drugs, and that's something you could send a message to your provider about. But mostly we think that long-term cancer survivors seem to be at the normal risk of the normal population. Again, I think that cancer patients have had their world disrupted, so I think they can be leaders in how to change the world around them. So if you see people kind of not taking it seriously, I think that you can be the advocates in washing your hands, and you know what it is to live in that fear of cancer recurrence. You know what that feels like. And so using that to direct people to say, hey, maybe you feel fine, maybe I feel fine, but here's some things we need to do to protect people around us. And so I think that's where people can be leaders. And the thing about cancer survivors too is that, again, you can be at risk for other comorbidities that you may have that don't relate to cancer. Diabetes, COPD, asthma, these things may make you at more increased risk than the actual cancer diagnosis itself. So taking the medications and managing those comorbidities or those other medical problems can be just as or even more important than the actual cancer diagnosis for some of our long-term survivors.
Yeah, so for some people that question, like they might not have a scheduled oncology appointment, but they wonder if they're immune compromised. It's not an urgent question, but they would like it answered. So that's a good time to use the electronic medical record either on their computer
Yes.
or use the app, is just send a message, because that way you're not feeling like you're calling with an urgent call, but you did put the message out so you can find out, am I on an immune suppressive type of treatment? Like, does my treatment count as that or not? And do I need to be extra cautious?
Yep, very much so. It's also a good chance to look at cancer.org, cancer.gov, and any of the disease site specific, like the Leukemia and Lymphoma Society. That's a great resource for patients who have had multiple myeloma, leukemia, lymphoma, to go and see they've got great videos up. They are interviewing and doing podcasts and videos of amazing world experts. I mean, it's people that normally you wouldn't see, but these are I guess in the nerd cancer world, to see them at a podium, you're like, oh my gosh, Dr. Perez is giving a talk. So I think you're hearing it, you're getting these opinions from the leading thought experts in these diseases. And they're also interviewing a lot of experts from places like Washington, like Italy, like Spain, like New York City, who are seeing a lot of influx of cases. So their experience is a real-time experience. It's not just a case here or there. It's what they're actually seeing in their cancer patients in these areas that are hardest hit.
Great. And I will say too, for like you were mentioning, family or friend, if someone's doesn't feel competent to email their providers, they can give access to a trusted family member, which I've done for my dad. He checks his stuff on the computer, but he doesn't use his phone. And it was the same electronic medical record that I use for my healthcare providers that his healthcare providers use. So it was really easy to actually add him on. So I checked his notes before he ever checked his notes. But like, that's a way that if you can't physically be near your family can play a role in helping you through this time.
Yes, it's important to give people jobs, just like you did again for your cancer diagnosis. So, hey, can you be my electronic medical record person? And that may be somebody that's doing it for multiple people in the family, and having that one person give them a job to say, hey, instead of sending me links to the next cure for coronavirus, would you mind doing this instead? And that gives them an activity and something to feel like they're serving you as someone that they care about very much.
Yeah, redirect them.
Yes.
So thinking further in the future, I feel like we got through like this initial phase of like, what's going to happen? Now we're all like settled at home, and now people are kind of antsy to like get back out, or quote, go back to normal. And of course, cancer survivors know what it's like to have people expect them to go back to normal, and life might never go back to normal as you knew it before. But I'm curious, as we think further in the future and we think about like our first steps into re-entering public life, we might have social distancing requirements like lifted, but cancer patients and survivors might want to be extra cautious about how they re-enter public life. So do you have thoughts on maybe what it would look like for first steps for people who are more concerned about their risk levels?
Absolutely. I think that it is important to put this in I think you explained it beautifully. We're kind of through the initial crazy phase, but again, this is a marathon, not a sprint. I think that our vaccines are probably a year and a half to 2 years away. I hope that I'm proven wrong, and that would be wonderful. But I think we need to find a long-term strategy that allows us to sort of live in this world, but yet respect the fact that the majority of people who have this virus are asymptomatic. So there are people walking around who are not going to know that they have this virus. So I would say for people under active treatment, let other people go first and see what this social distancing is. I don't think our cancer patients under active treatment should be the first ones out, to sort of, you think about like a bird out of the nest or a bear cub out of the den, in the spring. Our cancer patients shouldn't be the first people like making that, who are under active treatment and whose immune system still should be compromised. And I think it's going to be, I heard it described as a hammer and a dance. So we've just had the hammer, which was, the social distancing was doing a great job of controlling this virus and decreasing load on our hospitals, but now it's a dance. And so it's going to be a dance of trying this. We go out a little bit, and maybe it's like a toddler taking their first steps away from mom. It's I'm going to take 3 steps towards a table. Does that work? Is it safe? Do we see an increase in infections? So I would encourage our patients and their family, if these social distancing rules and regulations are lifted, I think that there's some economic arguments for that, for sure. There's some access to healthcare and food and necessary services where we're going to have to figure this out, but maybe let other people go first.
Mm-hmm.
Second thing I would say is that for our cancer patients is maintain that 6 feet distance, is to decrease your contact with people who are sick. Unfortunately, that's probably going to mean children and grandchildren a lot longer than we are comfortable with. We have no idea right now, because we haven't tested enough children on what their carrier and transmission rate is. So anybody who's sick, anybody who wants to be in close contact, especially with your eyes, your nose, and your face, which could be your young relatives, that I think maintaining that for longer is probably going to be a smart thing. Because again, that could be an asymptomatic, somebody who's not showing any signs, that could pass it on to you. And I think we're probably going to need to get into the long haul of what it looks like to wear a mask out in public most days. And to do that so that we aren't passing on that virus and that nobody's passing it on to us. And I think we need to kind of realize that that's the new normal. So I would sort of figure out, again, it's sort of like our cancer patients and our cancer survivors, as they come to the end of their treatment, we see them once a week, then we see them once a month, then we see them once every 3 months, then we see them every 6 months, obviously always seeing them back if they have signs and symptoms. But again, as we go forward, it's not like we're just going to open the doors and everything's going to happen. And I think it should be this gradual process of opening. And I really don't like to see our cancer patients and our survivors and their immediate family be on the first wave of that.
Yeah. So important to remember that as you are sort of waiting back and allowing other people to be the first ones to go out, that also includes anyone who would come within your 6 feet.
Yeah.
So whoever lives with you
Yes.
needs to be committed to that, to the same sort of restrictions that you want for yourself.
Yes.
And anyone who's going to come in to your home or within your 6 feet circle also needs to be an extra cautious person, because anybody they've been in contact with is basically, they are a conduit for you being into contact with that person.
I think it's a great time too for our cancer patients to say, hey, look, it's my cancer. So don't blame it on the virus. Don't blame it on anything personal. Don't get into some big political argument about people. Just say, hey, it's my cancer. This is what I have to do to make myself. And I really appreciate your support in getting me through this. This is just my next step in dealing with cancer. And so just to use that as the reason that you're doing it kind of takes away any, I think anything that people might ascribe to a particular motive, or you're just being, really, overly dramatic. No, it's really for my cancer, and this is what my family and I have decided, and just leave it with that. It's enough. That's a decision that
Mm,
you've made. And I'm probably a cautious person by nature, but particularly with my patients who have already faced the greatest threat to their lives, which is the big C word. I don't want to send them out as that first wave of people. And I don't think that there's a lot of family members, if you say that I'm doing this for my cancer, that are
mhm.
going to force themselves upon that. And I do think this is a time for innovation. This is a time to think about things differently. And our cancer patients and survivors are used to doing that. So again, finding these different ways of when and if these restrictions are lifted, how can we have our friends and family outside the door? I stay on the porch. I still want to see you. I still want to interact with you. I'll set up a scavenger hunt that I'll send to the grandkids, and they can be outside in my yard, and I can see them
Oh,
laugh and scream and do all these things, but it's happening away, but it's still an interaction that can happen with other people. I think that's an amazing way. Or I'm going to send your parents a scavenger hunt that you can do in your house. So
that's
it's a time for
fun.
innovation and creativity. Yeah. And I think that's just, it's important to maintain that connection. I don't think we can put patients in a bubble. We can't put ourselves in a bubble. We, as a species, are community based. We are meant to be in community with others. Some of my introverted friends would say they have been living for this day when they can just stay in their homes and never interact with another human for their whole lives. So this is like wonderful for them. But we all need each other. We need that social connection. So I think finding a way to do that as a group, as a social group, and do that as a society is going to be a real challenge. But I think that our cancer patients are uniquely suited because they have sort of done this dance before. It's to a different music, but they've kind of done this dance before. And I really think that our survivors have a chance to lead on this and say, I've been here. I've got these skills. This is how I did it. This is how I slowly stopped thinking about cancer every day. This is how
Mm,
I slowly stopped thinking about the virus every day. And I really look forward to seeing survivors be leaders in this.
yeah. Well, I really appreciate you sharing all
Thanks,
this
Julie.
information. And I would encourage anyone who's watching or listening that you are welcome to send questions to me. And we are looking to interview all kinds of experts. I'm sure we'll be able to get Dr. Wentworth back another time. So if you have questions, please send them. You can send them to Julie, Julie, at cancerservicesonline.org. You can call our office and say, hey, why don't you guys ask that doctor about whatever? um,
Yes.
whatever is the easiest way to reach us. We're 760-9983. And we hope that this has been helpful, but well, I just really appreciate you taking your time to share these awesome, great ideas with us. Thank you so much.
Thanks, Julie. And wash your hands. Thank you to all of our patients, and thank you for being gracious to your and so supportive. This community has been so supportive for our healthcare providers that are providing care for these virus patients, and our patients have been so patient and understanding with us as we try to interact with them in different ways as well. So I just am overwhelmed with gratitude on how our community is really taking care of us and how we've all come together to do this together. It's just been amazing.
We're very lucky.
We are. Thanks, Julie. Have a great day.
See ya.